Hello, hello, and welcome to Lisa Moss Medicare, another week of going through your Medicare. Now, I'm a licensed agent. I don't work for the federal government or the Department of Medicare. I'm a broker, so I work with all the different companies, which is great because I can look into the back office and see what is the best policy for you, if you're paying too much money, or are missing out on additional benefits. So that's what I do. I'm a broker within Medicare. And today we have a great program for you. We're going to do the 5 reasons to choose a Medicare Advantage plan. Now, before we get through that, we are going to, sorry, my phone just rang. Before we go into that, I want to first off let you know the difference between an Advantage plan and a supplemental plan so you understand what we're talking about. So when you go and get original Medicare, when you turn 65, or if you're disabled and under 65, you'll get Part A, Part B. Part A is your hospitalization. Part B is your doctors. However, it only covers 80%. So how do you cover the other 20% and have a drug plan? Well, you can get a standalone plan to cover the 20%. It's called Medigap or supplemental, and a standalone drug plan. It'll cost you in our region, the least expensive is $186.50. The drug plans run anywhere from 50 cents to $100. So your plan on spending along with your Part B of $174.70 about $400 to $450 a month that way. The other way is to go Medicare Advantage. Medicare Advantage bundles everything together. Your Part A, your Part B, your drug plans, and your 20%. They're all run by private insurance companies. So today we're going to talk about 5 reasons to choose a Medicare Advantage plan. Why would you go that way? Well, the first is budget. So with the supplement, like I said, you're going to spend $400 to $450 in our region, and every region, every county, every state is different. If you go Medicare Advantage, generally you'll have a zero premium, and your drug cost, you'll just pay your deductibles for your drug cost or co-payments. So you're only going to pay your $174.70 for Part B, and then whatever co-payments you pay for your drugs. You're not going to pay that $186.50 and whatever your drug payment is for your standalone drug policy. So you're going to probably save around $220 to $250 a month by going Medicare Advantage. So it's an extremely great monthly budget to budget. A lot of people go Medicare Advantage. That's our first reason to go that way, because sometimes even Medicare Advantage gives you a Part B give back. They'll give you back $50 a month for Part B, and you're not paying your high premiums for supplemental and the drug plan. So supplemental pays for 100% if you go to the doctor or you go to the hospital. Or Medicare Advantage, you'll have some co-pays and some co-payments. You pay as you go. However, you don't pay that large monthly premium per month. So you just pay as you go along. So budget is the first one. The second are the perks. When you look at the supplemental plans, even though they pay for 100%, they do not pay for dental, vision, hearing, over-the-counter benefits, and gym memberships as a whole. Medicare Advantage, generally they do. They'll give you all kinds of additions that can help you that you don't have to pay out of pocket. For instance, dental. Most of the plans pay anywhere from $1,000 to $1,500. Some of them go up to $2,500 for dental benefits. Some even give you food benefits. I have one plan that it's $40 a month just in food. Another is $55 a month. So there's additional benefits that you can get with the Medicare Advantage plan. That's number 2. Number 3, you have to be okay with networks. Luckily, in our time and age and in my county, and unless you're in a very, very small rural county, you have a network. So when you take a Medicare Advantage plan, you have either a PPO or an HMO. HMO, Health Maintenance Organizations, what's they're called, they have a network of people. So you go to your primary care physician, and if you want to go to a specialist, say a hand specialist, a foot specialist, he'll send you to a specialist within your network. PPOs are the same, but they have a bigger network. People with PPOs, they tend to cost a little more, but you can travel a little more with the PPOs. Luckily, in our region, the HMOs have a huge network. We're in southern Idaho, and we can go to pretty much anywhere in southern Idaho. Even some of them policies will give you additional funds that you can go out of state with. I know that Blue Cross is a great example. They'll give you $2,500 a year to use for any provider, even if they're not in your network. So you have to be okay with networks. If say you're traveling and you go to your daughter's house for 6 months out of the year and they're in a whole different state that's not in your network, an HMO may not be the best solution. A PPO or a supplemental may be a better solution. We also have pre-authorizations with Medicare Advantage. So you have to be okay with that, where sometimes they'll say, okay, we'll give you this medication like Ozempic. However, you have to have it pre-authorized by your doctor that you're not just using it for weight loss, you're using it for diabetes. So sometimes there's a little bit of extra paperwork where your doctor has to sign and send in a form. Or if the drugs are super expensive, they may have you do step therapy and give you a generic drug first. Or if you have another drug, your doctor may have to send in a pre-authorization for that. Sometimes if it's a very expensive surgery, they'll have a pre-authorization. Only about 7% of the time that happens, but it does happen. So you have to be okay with a network and at times having pre-authorizations. Number 4, the Advantage plans do come with a bit of a risk. So you have to know that going up front. They have what's called MOOP. I know, a funny name, huh? Maximum out of pocket per year. They run from 4,500 to about 13,000. So remember when I said Medicare Advantage, you pay as you go? So if all went wrong, you had a bad accident, you were in the hospital for months at a time, lots of tests, lots of doctors, your maximum out of pocket is the most you pay on a Medicare Advantage policy per year. I've never met anybody that's ever gone up to the top of their MOOP, maximum out of pocket, like 4,500, 8,000, 13,000. However, you have to know that that's a possibility. So all those drug deductibles, all those co-pays along the way, there is a maximum that you would pay per year. So that's the risk that you take if you have a Medicare Advantage plan. However, I've never met anybody that's gone to that maximum. The next is if you have VA, if you have TRICARE, which is part of VA benefits, or if you have federal benefits, you can get a Medicare Advantage plan without the drugs. So what I do is that with my VA people that I work with, my clients, I ask them, what type of VA benefits do you have? Because there's 4 different levels. If you're getting your drugs and your doctors from the VA and you're not on TRICARE, United Healthcare and Humana have a great Patriot program where it gives you vision, dental, hearing, over-the-counter benefits, gym memberships, and you use that only for those services. When you go and get your drugs, you get them from the VA. When you go to the doctor, you go to VA. You can use this as a backup if you want, but generally they'll go to the VA first. If you go to a walk-in clinic, you can use it. Usually there's a $40 copay or along that $30, $40. And you can use it for all the extras. So a lot of times they don't have very good vision benefits or any dental benefits with their VA benefits. So this gives them the extras. So if you know anybody that has VA benefits or has any questions on Medicare Advantage, have them give me a call. My number, I'm going to put it on the screen, 208-544-8255. 5011. 208-544-5011, or insuranceover65.com. There's lots of articles that I've written on there that may answer your questions, or you can email me directly through the website, insuranceover65.com. So those are the two easiest ways to get in touch with me. I am so happy to help you. I'm a licensed agent. That's what I do. If I'm not licensed in your state, I'll find somebody that's licensed where you live and make sure that you get all your questions answered. So I'm just going to check the comments, see if there are any comments. I don't see any. You're welcome to join me every week on the comments. I won't be here next week. However, most every week I'm here. You can also find me on both Facebook and on YouTube on Lisa Maas Medicare, and watch the recordings. They're always posted on there every week of these live events. So thank you so much for watching today, or watching the recording if you are, and writing any comments to me or giving me a call. I'm super happy to help you. Have a beautiful weekend and take care. I'll see you the week after next.